Hey everyone, it's Dr. Josie here. Today we're going to be talking about a very common issue, carpal tunnel syndrome. Whether you spend a lot of time typing, using your phone, or doing repetitive work, this condition can sneak up on you. In this video, I'll explain what's going on inside your wrist and show you some simple stretches and exercises you can do at home to find relief. So let's get into it. Carpal tunnel syndrome happens when the median nerve, which runs through this narrow tunnel in your wrist, gets compressed. This tunnel, called the carpal tunnel, is formed by bones and a ligament. Inside are tendons and the median nerve, which controls sensation and movement to your thumb, index, and middle and part of your ring finger. So when there's too much pressure due to inflammation, repetitive use, or poor wrist positioning, the nerve gets irritated, which causes symptoms like numbness, tingling, even weakness, pain even radiating up the arm. So if you're waking up with numb hands, dropping objects more frequently, or feeling tingling, especially in your thumb and first 3 fingers, that could be carpal tunnel. The good news is there's a lot we can do conservatively to help. So let's get started with some gentle stretches to open up the carpal tunnel and relieve pressure on the median nerve. So first we're going to do wrist extension stretch. So extend your arm, palm up. Use your opposite hand, gently pull your fingers down towards the floor. You should feel a nice gentle stretch in your forearm here. Switch sides. Once again, feeling that nice gentle stretch right in here. Next, we're going to do a wrist flexion stretch. So you'll do 30 seconds on each side. Flip your hand palm down. Gently press the back of your hand down with the opposite hand. This will target the opposite side right in here. And switch sides. Never force yourself into pain, you just want a nice gentle stretch. Next, we'll do the prayer stretch. So place your hands in a prayer position at chest height and slowly lower them while keeping the palms together. This stretches the carpal tunnel region directly. You can bring it up again to get some relief. And then back down. Holding for 30 seconds, repeating throughout the day as often as you need to. Feeling that stretch right in here. Stretching is very important, but so is strengthening and mobilizing the muscles and tendons that support the wrist. So let's do some exercises you can do daily to help with that carpal tunnel pain. We're gonna start with nerve glides. We'll do 3 to 5 per hand. So start with your arm outstretched, palm up. Curl your fingers in and then slowly extend them out. This mobilizes the median nerve. Once again, you never wanna be forcing it. But if you do feel like you need a deeper stretch, you can also tilt your head away. And this will give that deep stretch. You can do the other side as well. So palm up, back, and in. And then you can tilt your head away for a deeper stretch. Doing this as often as you need to throughout the day. The next exercise we'll do is wrist curls. So use a light weight, support your forearm on the table, palm facing up, and curl your wrist slowly up and down, focusing on control. You can do this 10 to 15 times per wrist. Help to strengthen these muscles here. Let's switch sides. Next, we'll do some wrist extension curls. So put your palm facing down, lift the back of your hand. This will focus on those extensors. Let's switch sides. You want to have your forearm on the table. That will really support it and make sure you're controlling those motions, not going too fast, too far into flexion or extension. Next, we'll do the thumb opposition exercise. So touch the tip of your thumb to each fingertip one by one, repeating several times. This will strengthen the thenar muscles. And we could do it on the other side. Repeating as often as you need to. So now let's talk about preventing some flare-ups. So here are a few tips. For ergonomics, you'll keep your wrists neutral when typing, using wrist rests if you need. You'll take micro breaks every 30 minutes when you're doing repetitive tasks to help from overuse syndrome. And you'll also avoid sleeping with your wrists bent beneath you. This causes tension in that area. These small adjustments make a big difference. Carpal tunnel doesn't have to hold you back. With the right stretches, exercises, and adjustments to your routine, you can find relief naturally. However, if symptoms persist or worsen, make sure to consult a healthcare professional. If you found this video helpful, don't forget to subscribe and share it with someone who needs it. Thanks for watching, and we'll see you next time.